Okay, good evening, everybody. Welcome to the Board of Health meeting for Monday, January 24th, 2022. We'll start off with the action items. So we approved disposal work permits for 41 North Bedford Street.
It's a repair that you approved in,
They never saw it.
oh, they never saw it.
No.
Never mind. And the last one, they moved the conservation post. So it's one of those.
Okay, so are we approving this conditionally?
They moved the conservation post and accepted it at Comcast.
Okay, so they did,
So now we're, yeah,
so they are 100% complete now?
yep.
Okay.
It's pretty much the best you can do for
Okay.
that site. It's a little shoehorn kind of a
Right, yeah.
property.
Okay, I'll entertain a motion that we accept the disposal works permit for 41 North Bedford Street.
Motion.
So motion Lisa, second Matt. Any discussion? Hearing none. All in favor, say aye. Aye, so that passes. Okay. Then we have some invoices from WB Mason and a mileage reimbursement. So we have December mileage. Okay, let's look at that. And $62 for office supplies for WB Mason. So I'll make a motion that we accept the mileage report reimbursement and the WB Mason invoice as submitted. That's motion Lyons. Second Matt. Any discussions? Hearing none. All in favor say aye.
Aye.
Passes. Okay, we have some food service permits, Renewals, Buttercup Bakery, they're residential here, and Society of St. Vincent de Paul Food Pantry, which is at St. John's. Okay, and then Ritter Farm. Now, Ritter Farm, is that something that was resubmitted?
Nope, so Ritter Farm, the application stated for a driving range and golf course, and when the permit was typed up, it just had golf course, not driving range, so the application is correct, so it really wasn't a big deal, but she was just concerned about if somebody came out and really wanted to be nitpicky, she wanted to make sure it said everything that was on the application, so I told her I would have you sign a corrected copy, so it's the same permit number, just says added in driving range and golf course, pro shop,
Okay.
which is what they've always had. And then we need to add in, I just finally, so Mary Lou's had their application in for a long time, but their check got lost in the mail somewhere, so it had not been signed yet, so they just hand-delivered their check today. So we need to finally sign theirs.
Okay, so are we,
That's a renewal also, so we're gonna add Mary Lou's into that. It just
Okay.
came in about an hour ago. The check went to Reading Board of Health, apparently.
okay, I'll entertain a motion to accept the food service permits for Buttercup Bakery, Society of St. Vincent's de Paul at St. John's, the Ritter Farm as corrected, and Mary Lou's on Route 18.
Motion.
Okay, motion Matt, second Lisa. Any discussions? Hearing none. All in favor say aye.
Aye.
We have one installer's permit.
Three?
I'm sorry?
We skipped three.
The body art permit.
body up numbers.
Oh, my gosh, yep.
So those were the two that we passed over last
Yep.
week, because we're
Yep.
waiting for updated
Thank you.
CPR certs, and we do have the updated CPR certs now.
Okay, so that's,
So those were in last week's packet, so you, unless you brought all your stuff from last week, you probably don't have it in there.
was it?
That's the inspection, that's later on.
Gotcha.
Oh, is that where it went?
We
Sorry.
got them last week.
Yep.
You weren't here.
I wasn't here.
Yep, they were missing CPR and first
You're missing
aid.
CPR updated with the new expiration dates, yeah.
Okay, so I'll entertain a motion to accept the body art permit renewals for Anthony Collin and Roberto Perez.
Motion.
Okay, motion Lisa,
Seconded.
second Matt. Any discussion? Hearing none, all in favor say aye.
Aye.
That passes. Okay, so back down to number 5, installer permits.
This was also in the packet last week, but you
Was that,
required a
okay,
test.
gotcha.
Yeah, we passed over that one, yeah.
All right. Never miss a meeting, as they say.
You remember, good memory, Matt. I was gonna say, if Rob
Okay,
wants to
so
look
they,
at it, I have
they,
it
they
here.
were missing CPR and what else?
No, A4R had to come in and pass the
That was
test.
the Perez, okay.
I do have the past test here if you'd like to view it, but they had to come take a test.
Gotcha. All right, because they're new, right?
Yeah, they had submitted for a renewal, but then we, they had done one, I guess, a long, long time ago before we started doing tests.
Okay. All right. So again, I'll entertain a motion to accept the installer permits for Ferrera Construction.
Motion.
This motion
Second.
Matt, second Lisa. Any discussion? Hearing none. All in favor, say aye.
Aye.
Aye. Passes. Okay, we have a Title V loan.
So this is the one that you've already viewed this week at my office, individually, not
Yes,
together.
okay, gotcha.
So you still need to make a motion, I believe.
Okay, so I'll make the motion that we accept the Title V loan as previously viewed.
Motion?
Okay, motion Lisa,
Seconded.
second Matt. Any discussions? Hearing none, all in favor say aye.
Aye.
Aye. Passes. Okay, and then we have the minutes from our 12/20 meeting and our January 10th meeting, which we received a copy via email, so I'm, anybody need additional time on that?
Nope.
Okay. I'll make a motion that we accept the meeting minutes from 12/20/21 and 1/10/22.
Motion?
Second.
Okay, it says motion Lisa, second Matt. Any discussions? Hearing none. All in favor, say aye.
Aye.
Aye, passes. Okay. So, at our last meeting, which I joined telephonically, there was discussion on beaver concerns. And Matt has graciously taken the lead to find out some more information, and I'm just wondering, Matt, if you want to bring us up to date. with what
The more information I got was from a member of the Conservation Committee, also the Deputy Chief of the Fire Department, who brought me out to the site and assured me that the site was operating as intended. There is a wire fence about 3 to 5 feet around the front of, on the high side of the culvert at Harvard Street, at which point the beaver is then now building its dam against that net, against that fence, as opposed to in front of the culvert. So now with that dam built out 3 to 5 feet away from the culvert, as the water level rises and then we get rain, and the water level goes over the height of the dam, instead of going over the roadway, it goes over the dam and flows through the culvert as intended. So the beavers will build their dam to get a certain height of water they like to live in, and then they build their den 200 yards away, and that's it. That's what they do everywhere they go. That's what every beaver in the world has ever done. They build their dam, they stop the water for a little bit, they get their water height, that's where they want it, and that's where they live. There was no signs, I mean, I'm not a trained beaver guy, but I was told there was no signs of beaver activity currently there, and that the debris that the gentleman, Mr. Brian, was his first name?
Brian, yeah.
Had seen wasn't actually debris, it was actually the dam. The dam, that's what the beaver does. It finds a spot, builds a dam, and then allows the water to build up to where it wants to go. I don't know. I'm not a beaver guy. I watched the water flow through that, over that dam and through the culvert. I don't know what to tell 'em. Short of moving forward and doing any sort of trapping, and that's for somebody else to request, that what we have worked on is working the way it's supposed to work, according to all people familiar with the.
Okay, excellent. I mean, that's really all we can ask for, that it's working the way it's supposed to work.
If it continues to be a problem, that's another concern.
Was a different color. Okay. Matt, thanks for that.
Oh,
Really,
sure.
really appreciate it. Okay, moving on to carriage crossing requests.
Can I just go back to the beavers for a minute?
Sure.
If you guys read the packet I gave you.
Mhm.
Yep.
This is historical with the water table and not a beaver thing, but on Crescent Street, the DBW recently removed a blockage on one side of the double barrel culvert. They need to do the same for the other side, because the blockage is actually the beaver dam. So, the beavers not only rebuilt the dam, but they also built a second one in the other pipe. Rob Kearns? Ken is wanting permission to put the same kind of solution at that dam, which is why I brought you back to the issue for a minute.
Mhm.
And the expenditure of the money would need Board of Health approval.
But they're not gonna be doing it until April.
We can't do it until April. Like, I agree with you, I didn't see any beavers out there either. So that's what he just wanted to let you know, that that's what they're thinking about doing, or
So then-
wanting approval from.
Yeah, something we can revisit when the time comes to actually do it, and.
We'll do that.
Doesn't
Okay.
get lost in the jumble.
Okay. Carriage crossing.
Carriage crossing.
Do they have?
Yeah,
They
they
have
do.
it. Okay, thank you. It's my understanding that carriage crossing got permission from the Board of Selectmen and the sewer commissioners, I think,
To tie in.
to tie in. The general form is when you tie into a sewer, then you abandon your Title V system in place. You fill any tanks or grease traps or whatever that you're not going to use. You either take the old system out or fill it in, just so you don't have large voids with that aren't active. You take any chemicals you're using off-site, you decommission it, basically. He doesn't want to do that. So he submitted a letter to us, SEA Engineering submitted a letter to us to not have to do that. This may have to go back to the selectmen and the sewer commissioners, because this is a change in the scope of the work.
Yeah, I would assume that they must have some sort of a contract for their tie-in that would incorporate those regulations, but we would have to reach out to them before we could.
Right, I just wanted the letters to you, so I wanted to make you aware of that. You typically don't leave a Title V system
No.
in place. Just like you don't leave an old cesspool when you put a new septic system in. Because you're leaving voids, you're leaving some kind of a structure in the ground that can trap water and other things.
Yeah, I'm not familiar if their contract with tie-in implements any of that, or if that's designated as an outside cost to the actual establishments tying in.
It's not just that, if they didn't mention this the first time through, it probably should be revisited by both those
Right.
parties, because they were given information and the approval was based on that information and that scope of work.
Okay, so Jean Marie, you're gonna bring this to the attention of the sewer commission?
Right, well, I did, and I didn't get an answer. I shot him an email, and I haven't got a response yet.
I would send a copy to Peter Spagone as well, because he seems to be
Right.
spearheading this whole project.
Yep, yep. So I'd probably say that you wouldn't act on it until you get the feedback from
Correct.
the other approving authorities.
And I'd also wonder, should this plan be sent to the engineering firm?
That's already been approved, that plan's.
This
FDA.
new plan with the
This
existing?
new
with-
plan is what was approved.
That
It
was
says
approved, yeah.
nothing about the septic being abandoned.
Yeah, that's what,
That's what
I
he's-
want them, I want the engineering firm to say
So I
what will
just-
happen if we have an abandoned
Right, no, I
holes,
get it,
you
yeah.
know, tanks in the ground.
Yeah,
It's a void space under concrete,
right.
is what it is.
You don't want to go out and be driving a truck around and all of a sudden fall in something. Okay,
Alrighty. Okay, so we've got here status of Sacred Tradition Body Art establishments.
okay, went out and did the inspection and they were actually nice. It was together except for that front step. And I ran into a little bit of a problem and I kind of tried to solve it on site. They don't have stairs. They don't have a railing. And also, the stairs are sturdy, but they're not mortared together.
Is this the back staircase or
Front step,
the one in question?
front step. So I wasn't comfortable, first of all, and it's also, there's only two exits, the front step and the back step out of that unit. So if we blocked them off, it would be a fire code violation, as well as, fire safety hazard. So I only gave them a temporary, which expires in February 13th. To have them put a railing and make sure that Patrick approves of the front steps.
Have we had any correspondence with the land, like the owner, or have they?
I don't have any, beyond sending him a letter, I don't have any phone number or anything for him.
Okay.
No, I
We put
thought
the onus on them to take care of it, I think.
It's been 4 days.
But
I
back
thought the
step's
owners
fine.
of the tattoo shop bought the building, but I'm not 100%.
No, they rent it.
No, they rent it,
They
it's
Oh,
rented,
Okay.
yeah. So I notified the building inspector, gave him a temporary, that's kind of where we're at now. And you meet February 10th, I think is our next meeting?
First Monday, February, I think that's like the 7th?
You'll be meeting before that
Mhm.
expires, I guess is where I'm going with that.
Okay. Hopefully they'll contact us for re-inspect,
Yeah.
and they'll have a railing up.
Right.
I would say maybe in the next week or so to send them an email or a letter just designating that if the issue's not resolved, then their permit is revoked, so they need to make sure they stay on top of it.
I actually sent them an email on Friday, very similar to
Yeah.
that, and I'll send
I
them
know
a
the
hard
building
copy.
department is working on it because they reached out to me for contact information for Maria to get, because they couldn't find the landlord contact information, so,
Slowly going towards where it should.
yeah. It's just because of the
Yeah.
time of year, it's like with snow and all, I don't know.
So our next meeting is on the 7th.
Yes.
First Monday, yeah.
First Monday, yep.
Yep. Okay.
Next update, 2 septic systems that are almost done, and I don't have any else on the books for right this second. Just let you know, the Maven contact tracing, we hit a peak over MLK weekend with 50 to 60 calls each day. The specific numbers are kind of hard to track because the system kept crashing, which will go back to 1 on us. So it was difficult, but somewhere in that neighborhood. The emphasis now is on vaccination, mask wearing, and appropriate testing. Those are the important messages that we've been stressing. Flu cases have started to increase. Did you actually? We had what, 30, 20 to 30 a day now?
Flu cases, we've had 15 total. Yeah.
So if people think they're sick and they're testing negative for COVID, it's probably the flu. Beaver you did, and review animal control duties and responsibilities. I've had some conversation with Lexi. Lexi's leaving, that's what's kind of driving this process. They're trying to update the job description. Historically, animals have been done by boards of health as sources of infection and contagious disease. That's where it comes under Board of Health, under that whole broad category of infectious and contagious diseases. In towns that it hasn't been designated to the Board of Health, it's the Board of Selectmen who nominates an animal control officer or an animal inspector, and then that person is then nominated and appointed by the Department of Public Health under Veterinary Services. And that person then does animal health inspections. So that's how that kind of ties in.
I think that's on the selectmen's agenda tonight, actually.
Okay.
In East Bridgewater, I think it's still with the Board of Selectmen to nominate to Department of Veterinary Health an inspector, an animal inspector. And that
Sorry,
ties-
so you said that is on the board?
It's on the selectmen's agenda tonight, yeah.
But that's how it kind of got around, that's how come it's sort of semi under the Board of Health.
Mhm.
It's under the whole thing of sources of disease, infectious, contagious control, that whole concept.
Is there something you'd like us to do for this, or it's in their hands anyway, right? It's-
Yeah, I just, there is
It-
confusion, it's not uncommon.
Yeah.
The other thing is, there used to be an old law that required boards of health in populations of more than 12,000 people had to do barn and stable regulations. East Bridgewater doesn't have them.
Okay.
So that's where it would fit in there, too.
Okay.
So that's about it, I think.
Okay, so looking at meeting schedule,
So are we all good, just going back to the first and third, now that
Yep.
all the crazy holidays are over? So obviously, well, in February, we'll only have one at this point, unless we have to call a special one, because the 21st is President's Day.
okay,
But we can always post a meeting if something comes
If
up and you
some-
guys feel like you have to meet, so we could just go post a regular first and third schedule going forward. 5 o'clock, still work?
Yep.
Want to talk about the numbers?
For these?
Yeah. Talk about how the surges passed, the numbers.
Yep, yeah, I sent you guys an email today with the numbers. I kind of broke it down by week for the last 3 weeks. I gotta go back and look at my email here. But I think it was somewhere in mid-400s 3 weeks ago, then we dropped down to the 200s 2 weeks ago, and then the week we're in now, and I'm doing Monday to Monday as a week, because we meet on Mondays. The week we're in now, we're down to the low 80s. You know, and I'm sure everyone else watches the same. The news channels show the same news every morning, all 5 stations, and, you know, I also heard Dr. Fauci talking this morning about Northeast, you know, is on their way down. The surge is coming to an end in our part of the country. So I just wanted you to have that information. I think that's good news, you know, I mean, obviously, it's not gone, but it's good news.
Okay. So last meeting, we made a motion and voted for a motion to recommend to the Board of Selectmen that they do something about masks in the building. Do we want to re-examine recommending anything to them at all?
So I think we can revisit that and come back and make a recommendation that we can go back to the state guidelines that you should wear a mask but not keep the mandate in place. At the time, that was the week that we had 407 cases, and now we're down to 83, so there's been a significant drop, so I don't really think they need to mandate that any longer.
I'd like to see us revisit it in our meeting in February. It's just a couple weeks away. 1 week does not make a.
Well, it hasn't been
Yeah.
1, it's been 2.
Oh, okay, all right. I don't know if that's gonna be a permanent trend. And then we can make the recommendation one way or the other back to the Board of Selectmen, and they can choose what to do with it as they see fit. You know, another concern is oscillating back and forth. So if this thing goes up a little bit, comes back down, goes up a little bit, you know, now we're not sending a consistent message. So if we just keep it in place for 2 weeks until we're back here on the 7th, have a little bit more better view as to what the numbers are over a little bit longer period of time, we might be able to make a better recommendation.
I disagree.
Okay, oh, yeah, that's fair.
Alternative.
Okay.
Only because I think it's becoming an issue where the state is going in one direction, and this is kind of putting a little cap on our town-owned buildings. I feel the employees are getting a lot of heat. Nobody wants to mandate this. No one wants to take the lead role. We certainly aren't governing this. It's supposed to be governed by the Board of Selectmen, and I
Right.
think the ball is being bounced back and forth as it is.
Well, it should be theirs to enforce. It's their policy for the town buildings. And they can rescind that at any time. They can make changes to it whenever they wish, and they would also be the enforcing agency.
That was my understanding.
Right.
But feedback from patrons of the town are that when they're calling the Board of Selectmen's office, they're saying they're abiding by our wishes because we made the recommendation. So I think that we're not necessarily going back and forth, we're going along with state guidelines. If they want to wear a mask because they feel comfortable, they can certainly do that, but we're not mandating those who are vaccinated and boosted and coming in for 5 minutes to pay a bill to have a mask and go through all that rhetoric, and then the poor person at the door is arguing and getting into a tense situation.
And this is the exact discussion we had 4 weeks ago, before we did this, where this is where we didn't want to be. And we had the discussion, and through the course of the email chain on that day, the question was, are we making a knee-jerk reaction to 400 cases? Do we have any more information about this? We really didn't at the time.
I mean, the state epidemiologist is saying that this Omicron variant is following a flu-like pattern, and they predicted that by the end of January, the cases would dramatically drop and fall off. So this is like an epidemiology thing. It's not just a rarity that the cases are dropping down.
The word they're using is endemic. You know, we're not in a pandemic, we're in an endemic. It's like flu. It's not gonna be eradicated. It's just something we're gonna deal with on an annual seasonal basis.
Would you feel more comfortable if we recommended that the Board of Selectmen make rules reiterating their belief in the state guidance, that we should be vaccinated and boosted, and that we should be wearing masks if not, and things like that? At the end of the day,
Yeah.
we didn't want to do this. We
Yeah.
were approached by the Board of Selectmen and asked to do it. And now it's kind of come back.
Well,
on
we were
us.
asked, I don't see, even coming in a couple of times in the last, last week, hasn't been a tremendous amount, but tonight's another example. There was a gentleman in front of me, he saw the sign, he said, oh, you gotta get a mask. I said, oh, no, they have them at the desk. He asked for a mask and went on his.
Yeah.
So I would think maybe we should get some input from the Board of Selectmen on what they're seeing, what they're hearing, and is it really an issue protecting, some of the folks that are here in the building?
Well, I don't think it needs to go back and forth. I think that in stating that we are in agreement, if they would like to lift the mandate, we're in favor of that. We're in favor of whichever they would like to continue as their mandate, not us.
This is where it comes from.
Yeah, but
we were-
that just says, just do whatever you want.
Which is what we said to begin with.
Yeah, well.
We recommended that, here.
The state
this
doesn't
is
have a
what-
mandate.
The state doesn't have a
So,
mandate. If you guys would like one, go right ahead. That was the entire point. If we hadn't been asked to do one.
Which is what they have, they can rescind it at any time.
But what's coming out of the office is that it's ours.
Well,
So they're gonna look for
then
us
let's-
for a recommendation
I
on
would,
how-
I would say that then we would need to have a meeting with the Board of Selectmen. I mean, they're meeting tonight, we can certainly stop by
I
and.
don't know if we can do that.
Well, they have open forum, but, yeah.
All three of us are here.
Well, no, I mean, technically, the meeting's still posted, so yeah, it's.
I just think there should be, again, there was, like you said, there was some communication as to what their wishes were or what they'd like us to consider. So I would just, again, I would like to see another couple of weeks, make sure this thing is headed in the right direction, and then we can recommend one way or the other. I don't see the extreme harm or detriment in waiting 2 weeks.
I don't know, can I make a motion? How does that work?
I'm
You can do whatever you want.
So, I mean, I would like to make a motion that we give the selectmen our encouragement to either continue or dismiss the mask mandate for town and town-owned buildings. If they would like to continue it, that's fine. If they would like to remove it, that's fine. We are in favor of their judgment either way.
That sounds confusing.
Yeah. It's basically the same motion we made last week, which was, if you guys want it, go right ahead and do
Yeah,
it.
we-
Yeah, it
Recommend that
is-
you
it
guys
is
do
the
what you
same.
want.
I mean, personally, I don't see the need for there to be a mask mandate in town buildings only, because it's very mixed as it is, between, I can go to CVS, I can go to a restaurant, but then if I'm gonna pay my excise tax bill, I have to wear a mask. I think it's kinda silly, but.
Well, I think the difference there is that, you know, from my understanding is the Board of Selectmen, it has a desire to protect their employees. And.
Well, now you're implying that
Well,
the independent
I-
businesses don't have a desire to protect their
Well,
employees.
that's up to them. Some do and some don't. Where, as a business runner, I would want to keep my customers happy and healthy. Otherwise, they can't come in and spend money.
Mhm.
And then as somebody who, again, is an employer, who needs his or her employees healthy and show up and work and produce. So it's my opinion that it's an employer's best interest to make sure that both their customers and their employees are as safe as possible. So that's where I'm coming from, where I'm saying this is, you know, if somebody else in another sector or another business chooses to do something differently, well, okay, that's maybe how their business model runs. I don't particularly agree with it, but that's theirs to do. No different from the Board of Selectmen, you know, again, wanting to protect both the employees and the citizens. So I would think it would be up to them that if they want to pull back or if they want to force it, that's their call.
That was the entire point of the meeting last week. The issue is that it is not being handled that way. It is being handled as if we are holding the ball.
Okay,
So
well, then
we need
let's
to-
have a discussion with a departmental partner. I mean, any one of us can reach out and have a conversation with them if that's what we really feel. And if we're seeing something different on the ground than as it was intended, then those communications should be taking place. It's like, hey, you know, we did that. Well, it's not so much that we did this, but we're not seeing the results that we thought, or that maybe even you thought you were getting. And, you know, for whatever reason, they're not seeing it. Again, they're you know, a few hours a week, just like we are. So I don't know what they're not seeing, or if they're I haven't had a conversation, so I don't know if they're happy with the performance, not happy with the performance, have a different plan in place, or think it's going just fine. I mean, anytime I've been in this building, I have not heard any pushback from anybody at the door, anybody coming in. Now, I'm not saying that doesn't happen, but that's just what I've seen. So I'm sure somewhere in the middle is a difference. But I haven't talked to anybody in the Board of Selectmen. If you guys have, then let me know. We can have that discussion, but I think it's fair that we engage them as part of the conversation. If we really think that it's not being implemented or that there's a challenge, then let's raise it.
That's
That's
not
not
the
even the
concern.
question.
The concern was, the question is, here, you guys want us to do something about this. Okay, well, we will recommend that you guys do something about it. And what came out of their meeting was, you, meaning us, recommend that we do this, so we're doing that. Not,
It's still the same verbiage, we recommended, and they're saying, yeah, okay, well, we recommended.
but when confronted with why are we doing this, it's not because we decided to do this, it's because they told us we had to do this. And we said, we recommend you guys
Well-
do what you want to do. If they don't need us to tell them to make an ask.
I just, you know, again, I could only hear certain portions of it, but regardless, I just, you know, felt that we were making a recommendation based off of, you know, the fact that, you know, again, correct me if I'm wrong, that you can be positive and contagious 2 to 3 days prior to testing positive. isn't
That
it?
has not changed since the inception of
Okay,
COVID.
but it's still, people can be walking around asymptomatic.
Mhm.
They can be walking around infectious prior to
Mhm.
testing positive,
Mhm.
so, and spreading the
Mhm.
disease. So, to mitigate that, here's what we're recommending. We're recommending a mask policy in the buildings of East Bridgewater.
Yep.
So we made that recommendation to the Board of Selectmen. They took that recommendation and they put in a mask mandate.
Mhm.
So as owners of that, they can rescind that, modify it, adjust it, and/or enforce it in any way, shape, or form. Now, if we think what we recommended is not being managed properly, or implemented, or enforced, then it's just, we should have that conversation with them. So I don't, my position is that we wait, we come back and look at this in 2 weeks. In the meantime, we pull some more information together, talk to our peers over at Board of Selectmen, and see if there's any way that we can, if it's not working, how we can brainstorm and come up with ideas to make it work, or maybe it's past that point and it's no longer warranted. I think that should be a conversation between the two departments.
Well, I still think, I would like to make a motion that we rescind the recommendation to the Board of Selectmen to have the mask mandate in town-operated buildings.
All right. Motion, Lisa.
Second for discussion.
Second, Matt.
Do we want to, for discussion, more discussion,
Yeah.
do we want to replace it with anything, or just take it off the table if it never happened? Because on one side, I believe that Rob's got a point, that facilitating back and forth is a bad idea. But the other side is that our motion wasn't taken the way it was intended.
Correct.
And I don't want to just make it look like we're just going, oh, yeah, whatever. But we should be replacing it with some sort of informed statement that says, this is what we're doing, this is why we're doing it. We're not just playing games.
True. I think
Can
we
I-
should
can-
go back to the state
I
guidelines.
say, can I add
Oh,
something?
Yes.
Susan, yeah.
Just because I've been in the thick of this for 2 years now.
Yeah.
I would say that I don't think it was a bad thing that you did it 2 weeks ago,
No.
because we were going on information. We had 400 and some odd confirmed cases, never mind all the home tests we were getting called on. We were right in the middle of it, and it was 2 weeks after, actually less than 2 weeks after the holidays.
Vacation.
We probably should have done it 2 weeks before that, or maybe not, maybe a mandate, but maybe come up with something to keep everyone kind of safe for like a month. Like a lot of towns did hybrid remote work for like that month. A lot of schools closed for a few weeks to prevent a surge, okay? So I don't think it was a bad thing that we did it, because we were, we didn't know what was gonna happen. We didn't know if it was gonna drop off in a week or a month. So I don't think it's bad, but I think that, it is tough because, we see people come in without masks, and it's not, they're not trying to prove a point or do something, they're not used to it. They go in everywhere without a mask now. And we're trying to get people to get vaccinated and boosted, and a lot of people feel like not wearing a mask is their reward for getting vaccinated and boosted, and it's hard to promote vaccination and boosting, And we don't work here. I mean, I'm not, it's just, fire department's different, police department's different. Every town building is different, but there probably isn't one person in East Bridgewater Town Hall that works within 6 feet of each other. And when the people come in, we've all been set up with glass everywhere. So people will come in occasionally for a meeting, and if that person is more comfortable that you wear a mask, we have masks available, we can put a mask on for them, and we do that. We've done that for the last 2 years. An elderly person comes in, they have a mask on, we can sense they're nervous, so we put a mask on, of course. But I think maybe, we just go forward and say, at this time, CDC and DPH, they're the medical authorities, they're the scientists, whatever they will, we'll post their recommendations as they're updated, and everyone should just follow them.
Agree.
And we could also
that's-
provide our numbers, so this email that I sent you today with the numbers, I did not provide to the Board of Selectmen because I wanted you guys to discuss it. So we could also provide that information to the Board of Selectmen for their knowledge, so they know where the numbers are.
I just don't like leaving it in a void. I don't like, that it's a vacuum. I don't want to, we got to fill it with information.
I think we're gonna have the same thing next winter. I think it's
Yeah.
gonna, you know, it's an endemic. I think
Yeah.
every winter we're gonna face it. So maybe like if we see the numbers, we catch it early in next year, say, okay, like for the next a month, we're gonna recommend that people, you know, like back when we were locked down and somebody would work from home, somebody would work here, right? If you're in a high risk situation, you know, DPW guys don't drive together, or, you know, who knows what will be next
Sue
year.
and Lisa, because, you know, Rob and I were on the board when this happened, when the town went into lockdown and closed town buildings, did the Board of Health recommend that, or was that something, a unilateral decision that the Board of Selectmen made on their own?
Ah.
The state told us, right?
Yeah.
Yeah, it was, well, actually, with the town employees, we were considered essential employees, but
Yep.
that was, something, Brian Noble, who was the previous town manager,
Town
he,
administrator.
yeah, he leaned
Came
a
from
lot.
that office.
He leaned
Did
a
not
lot
come
on,
from the board.
yeah, he leaned a lot on the past chairman and myself for guidance on that, but in the end, you know, the selectmen knew that that was
That was
the
coming.
safest thing to do. So we started we didn't really go into full lockdown, we just didn't let the public in, you know, like
Yeah.
Ellen would be here one day, Dottie'd be here one
Yeah.
day. I was here every day, but other departments, it was one person a day.
But, and
It was a, you know,
just to, you know, expound on that, you mentioned, you know, going remote.
yeah.
That's not something that we can tell the Board of Selectmen to do.
No, but if
Not
we
at
knew, you know.
All of these mitigation, my point is, all
Yeah.
these mitigation things
Yeah, that's
that
up
could
to
have
them,
been
yeah.
done to
Yeah.
slow this down
Yeah.
are
Yeah, but I
in
think.
someone else's court.
Yeah, but I do think a lot of towns, like when you know, the different news stories that have come out over the last month, I think a lot of towns do say, you know, after discussion, the school, after discussion with the Board of Health, the Board of Selectmen,
Yeah.
after discussion. So I think, you know, it's
Because they want to know if this is.
it
a
should
good
be a
idea.
team, you know,
Not-
it should be a team
team,
effort.
Which we thought we were doing.
Right.
And just so people at home are aware, and not following the cases, the information that was compiled by the board was that from January 3rd to the 10th, we had 407. The following week, the 10th to the 17th, it was 228, and then from the week of the 17th to the 24th, we were down to 83 cases. I mean, I'm sure there'll be fluctuations maybe in February with February vacation, but we seem to be in a positive trend.
Probably also, and I know we're still in discussion about this motion, so it's not gone yet, but, you know, keeping in mind also that starting next Monday, DESI is stopping contact tracing in schools. So there's no more test and stay, there's no more contact tracing. They don't feel like there's much there's much transmission within the schools, so they're gonna be doing a take-home test type approach at the schools. And same thing with early EEC. They're changing their approach so that kids are gonna be able to take home tests if they're a contact and test in the morning and still go to daycare. So they're really kind of relaxing some of the policies because I think they know it's here forever,
Mhm.
and we
Yeah.
can't do this forever, you know.
I think the other part of that is those of us who do work close contact with people. I go out and do food inspections, I can't possibly be 6 feet away from somebody behind the counter. I always wear N95. Like your fire and your police, if they're in close contact, they're still doing PPE and N95s. So those of us that do go into people's houses are wearing masks.
Mhm.
So it's not that we're not wearing masks, we are wearing masks in appropriate settings. Whether the plumbing inspector, the building inspector, the Board of Health agent doing inspections, those people are all still wearing masks. So that's kind of an important key thing.
Yeah, outside, but that's outside of the building, close contact. We're doing it of our own agency to protect ourselves and the people we're being around. This is a little bit different than,
Right, we're not, but we're not
Right,
gonna be
yeah.
bringing it back in because
Exactly.
we're out there.
anything else?
So what is the, and we really need to look at and spell out what is the motion that's on the table. And I had a first and I had a
Yep.
second,
Yep.
and I'm not
So-
sure what the motion is.
So-
So to clarify, I
Rescind
would
the
say we
recommendation.
will make a motion to recommend that the Board of Selectmen lift their mask mandate and resort back to the state guidelines per the COVID protocols for mask wearing. Is that a little clearer?
No, that covers it.
Refer to state guidelines for all COVID and mask protocol.
Protocol.
Yeah.
Okay, I'm gonna be voting no, because I just think we should wait just a little bit longer to make sure that we are in the trend that we're actually seeing, and that a week or two does not necessarily make it so. We haven't had any communication with the Board of Health in discussing anyone's concerns about what was originally intended and then what it supposedly turned into. We haven't had any feedback. We have had zero communications. So,
Just
any
on,
other?
just on your point, all we're saying is that, just to reiterate, this is your policy, you can do with it what you want. If they choose not to rescind their policy, they choose not to rescind their policy. We're just taking our name off of it.
Well, it still passes with the vote of 2 with a
Well,
noted
let's just-
objection
let's
by
go
1.
through. All right, so let's just go through the roles. Any other discussion? Okay, hearing none, all in favor?
Aye.
All opposed? Nay? So the motion passes 2-1.
Okay.
All right. Anything else?
You want to talk about the Massachusetts Health Officers Association?
Well, that's, I think that
Just a
is just
point
a
of
welcome
information.
letter, right?
Just need some information where you can go to websites
Yep.
or.
It's kind of,
Information, actually.
and this is to bring you back on to the,
Well, I've always
MOET.
been an MHOA member.
That came to me, to the office, because I signed us up, remember last year?
Mhm.
Yeah.
So that's just, I made a copy for that, because it's for their whole, it's for everybody, you know, like, all the board members can.
It's an incredible educational resource, that's for sure.
okay, if there's nothing else, I'll entertain a motion to adjourn.
Motion?
Motion, Lisa?
Second.
Second, Matt. Any discussion? Hearing none. All in favor, say aye.
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 Aye. So that concludes the Board of Health meeting for Monday, January 24th, 2022. Thank you, everybody.
Don't run off, we got stuff to sign.